The federal government has restated commitment to evidence-based reforms in the health sector, insisting that practical solutions must now replace research-heavy debates. Speaking in Abuja during the launch of a Knowledge Compendium by the Solina Centre for International Development and Research, Minister of State for Health and Social Welfare, Dr. Iziaq Adekunle Salako, said ongoing efforts are focused on ensuring policies are backed by real-life results that improve access to healthcare. A correspondent has details.
The compendium consolidates more than 10 years of field studies into a single volume, providing practical lessons for policymakers and health workers on issues such as immunization, maternal health, and HIV care.
Of course, we know that in the last 2 years, since the inception of the Bola Ahmed Tinubu-led administration, we have been navigating the health sector in Nigeria with some sort of clarity, backed by a blueprint that itemize and identify the areas we need to address. And one of the key things that we have also tried to do is to do accurate diagnosis before we implement.
Executive Director of the National Primary Healthcare Development Agency, Dr. Muyi Aina, also stressed the importance of new tools to guide work at the grassroots, especially in immunization and maternal health.
Because we are doing many things newly for the first time that we're different from how we have worked before, it is important that we are very sensitive to learn as we move, to take lessons from what we are doing, take lessons from what our partners as part of NISA and SCIDaR and all of the other partners that put together this compendium, and be able to impute those into our strategies and policies.
For Solina's Chief Executive Officer, Mr. Uchenna Ibokwe, the challenge has always been accessibility in research findings.
We know there is a lot of research and evidence out there. It's not surprising. We know, however, that in the format that they are presented, there is a lot of issues with people actually accessing them, with people actually reading them. You know, in many instances, they are presented in journals where people don't really go to read or go to check. They are presented in a way that people don't really understand. So a lot of technical jargons, a lot of data charts that makes you, if you're not an expert in that area. And for many of our policymakers, they are not necessarily professors in specific areas. For many of our health managers at the lower levels. So that makes it almost like it's the right information, but it's not in a format that they can understand.
Stakeholders are hopeful the compendium will mark a turning point for Nigeria's health system if effectively deployed, stressing that the real task lies in translating research into action. Naomi Oleribe, AGBN News.